Greetings from New Zealand. Stroke and cardiovascular diseases are the leading cause of death and disability in the world, and their increasing burden across the globe strongly suggests that currently used primary stroke and cardiovascular disease prevention strategies are not sufficiently effective. All clinicians appreciate the importance of primary stroke and cardiovascular disease prevention, but they simply have no time to individualize and document or monitor the recommendations and progress in the effectiveness of primary prevention of their patients. Enabling this would significantly enhance primary prevention and decrease disease burden. But currently, there is a big gap. There are no evidence-based tools doctors and people in the community can use to do this. Therefore, the overarching problem we are trying to solve is to reduce stroke and cardiovascular disease burden across the globe by means of innovative, far-reaching primary stroke prevention digital solutions. Our National Institute for Stroke and Applied Neurosciences of Auckland University of Technology, New Zealand, together with other national and international experts in stroke, primary care, and public health, has developed and validated two unique digital tools to address primary stroke and cardiovascular disease prevention. Based on famous Framingham Heart Study algorithms and international evidence-based guidelines, these tools are Stroke Riskometer app for lay people and Prevents web app for clinicians. Currently, the free-to-use Stroke Riskometer app is translated in 19 languages and available in over 100 countries for 5.3 billion people in their native languages. For those with poor access to medical services, it may be the only reliable source of information about stroke, cardiovascular risk factors, and how to manage them.
Another unique digital tool we recently developed and successfully tested in 27 countries is the Prevents web app. The Prevents web app takes only a couple of minutes to be completed. It provides editable, patient-tailored recommendations for primary stroke prevention for the individual. It shows the patient's 5- and 10-year absolute and relative risks of stroke and heart attack and specific risk factors. It also shows their progress over time for patients in both narrative and graphical formats, so it's easy to understand. There is also a goal-setting option. Then the clinician can save the data on a secure server of the health organization and print them out for the patient. The system also allows analysis of the data and integration with the Stroke Riskometer app and electronic databases.
Currently, there are no other digital tools that provide these capabilities. Our estimates show that with the global use of these two digital tools, it would be possible just over 5 years to reduce stroke incidence by 20%, avert at least 300 million deaths, and reduce the incidence of other major non-communicable diseases with common risk factors, such as ischemic heart disease, dementia, diabetes mellitus, and even some types of cancer. Needless to say, it would save global economy billions of dollars. This is time to act and implement these digital tools into practice. We would like to thank you for your attention.